the symptoms that you'll get with respiratory illnesses or viral illnesses include fever up to even 102. That's very common with the virus. You'll also see cough, cold, congestion, runny nose, sneezing, sore throat, sinus pressure. Normally, it doesn't really matter what color the drainage is. People really focus on if their drainage turns green, it means it's a bacterial infection. That doesn't mean anything. It just means your body is fighting some type of infection or something foreign. So whether it's allergies, viral, or bacteria, the color of the mucus doesn't really matter. Normally these viruses last probably 7 to 10 days, and by day 3 or 4 is the worst. So that's when you're really feeling it. That's when you normally will say, man, I've been sick for 3 days, I should probably go to the doctor. It's normally when people start coming in as day 3 or day 4. But the virus itself will last an extra week, so 7 to 10 days. And if you're a smoker, it can last a little bit longer than that. And sometimes if you have a cough, that cough can actually last for a few weeks after the other symptoms resolve. When should you go to the doctor? Normally what I tell my patients is if you've been sick for a week and something changes. So you all of a sudden develop a fever, or you all of a sudden you start becoming, more short of breath, your cough changes, you start developing sinus pressure or teeth pain that you didn't have before. Those are really the big signs that it's time to go to the doctor. And little ones and babies, if your baby seems to be struggling to breathe, if your baby's not producing a wet diaper at least every 6 hours, that's maybe a sign of dehydration. And that's really what we worry about more in kids is, becoming dehydrated while they're ill. So in those instances, I would probably see a physician at that point. Also, in kids, if they're running a fever for 3 or 4 days, temperature of 100.4 or higher is a fever. So if you're running a fever for more than 3 or 4 days, it's not getting better, it's probably time to go in and make sure there's not a secondary ear infection or something else going on.